partnership with Elation Health. My name is Sarah, and on behalf of the team here at Fullscript, we are so excited to have you here with us today. Before we get started, I just wanted to go over a few housekeeping notes. So today's session is being recorded, and a copy will be sent to everyone who registered. If you need to hop off early or just want to revisit any part of the presentation, you will have it delivered right to your inbox for you to access at a later date. The recording will also be available on Fullscript's website, where you can access our full library of past and upcoming webinars. If you have any questions during the presentation, please type them into the Q&A box at any time, and we will have some time at the end for our Q&A session, where we will get to as many questions as possible, followed by a quick demo for anyone who is interested. And now I am thrilled to introduce our speakers for today. We have Dr. Jeff Glad, who is Fullscript's Chief Medical Officer. Since 2019, he has played a key role in shaping our clinical strategy and product direction through the lens of integrative and family medicine. Dr. Glad graduated from Indiana University School of Medicine in 2001, and after running a successful family practice, he completed the University of Arizona's Integrative Medicine Fellowship. He later launched GladMD Integrative Medicine and Mitavan.com, the West's first nutrition depletion calculator. He's also a previous TEDx speaker and widely featured in industry media. Joining him is Fareed Tagavi, Senior Director of Partnerships at Elation Health. With over 14 years in health tech, Fareed is an expert in building strategic partnerships that empower clinicians and improve patient care. At Elation, he's led numerous initiatives that integrate smart solutions into real-world workflows, most recently through the exciting collaboration between Elation and Fullscript that you guys will hear more about today. And with that, I'll hand things over to Dr. Glad to kick off today's presentation. I'll be back a little bit later to join you for the Q&A.
Thanks, Sarah. Thanks for everybody for attending. It's exciting to be here. I've always while I don't use Elation in my practice, and I would really love to, but I think my staff, if I changed EHRs on them, would be a bit angry at me. But I love what Elation's done. And would love, Fareed, I'll share sort of a little bit about the vision of Fullscript, but then if you could just share kind of the vision and passion behind Elation and what you guys are up to, I think it'd be a great kickoff here. So Fullscript is really focused on being a clinical tool to optimize the delivery of whole person care. And we chose whole person care because we believe that's the largest umbrella to have the most providers to have significant impact on health in our country. We believe in three principles is how we define whole person care. Number one, healthcare should be health promoting and preventative, focusing on the root causes of what's going on in patients. Number two, it is a lifelong journey. So it's not an episodic experience of a one-time visit to deal with an acute issue. It's a long-term plan and a relationship with that provider and practitioner, which leads to three, healthcare is best in partnership with a provider. And so I think, Fullscript being able to partner inside of the workflow of an EHR is really exciting for us. And we are so excited with the partnership with Elation. Fred, do you want to share more a bit about your vision for Elation?
Yeah, of course. Yeah, thank you, Dr. Glad. And thank you all for attending today. I'm super excited to be here. At a high level, just to speak about Elation and Fullscript, I've been at Elation for 4.5 years. This has definitely been the most requested integration that we've had, and we were so happy to be able to finally kind of provide that integration and partnership with Fullscript late last year. The amount of positive feedback and the things that people have been able to drive more efficiencies in their practice has just kind of been so great to hear. Specifically to Elation, most of you, I imagine, are Elation users, so some of this may be repetitive, but for those that are not, Elation Health is an electronic health record and a platform, focused on primary care delivery. And we were founded by a brother and sister whose father was a primary care physician, located in Northern California, that operated their own independent practice. And, one of the big emphases of Elation is not only, to provide a vehicle to provide personalized care to patients, but really like value-based care. And I know often value-based care gets looked at as like insurance-based, medicine or risk, but direct primary care or direct care in general is very much value-based care. I personally myself am a consumer of direct care, and I just think it's the best experience for you to be able to gain value with your physician, build trust, and really deliver a level of personalized care that makes sense for you and helps you kind of achieve your goals. So we at Elation are big on that, and having like-minded partners like Fullscript make it much easier.
Yeah, that's awesome. All right, thanks. So let's dive in. And again, populate the Q&A, please. Any questions you have, Fareed and I want to spend time digging into those and really focus on, what you're thinking about, what you're wondering about. Ultimately, the outline here, we'll talk briefly about, what are the challenges providers are facing in being able to deliver personalized, value-based care, how those challenges impact the delivery of care. Fareed's going to walk through a case study showing the success of the integration of Fullscript inside of Elation. And then I'll talk about some of those benefits and double click a little bit further into what that integration would provide your practice, but also your patients. We'll then do Q&A, and as Sarah mentioned, then Arthi is going to run through a demo to show you how easy it is inside of your workflow to be using Fullscript on Elation. So ultimately, kind of want to walk through some of the healthcare challenges that we're seeing. I think all of us can sort of appreciate the global healthcare challenges. 95% of healthcare spending, which equals $4.5 trillion, is ultimately going toward largely preventable disease and mental health conditions. And these are things that patients are coming to direct primary care, wanting to address, wanting to talk about, want to be proactive about. But the sort of the technologies available to practitioners to deliver this tend to be disparate, tend to be very difficult to use, and often add a number of administrative burdens that don't translate into care of patients. And so it's why we see 50% of providers feeling stressed, 20% of providers feeling depressed. And just outside of these numbers, I can't tell you how many practitioners I've talked to who want to leave the field, are leaving my community. And it's harder and harder for my patients. I still practice in Indiana here, harder for my patients to find a primary care doctor. And then when they do, it's just not a relationship. So the opportunity is huge. Patients are demanding change. They're demanding to have these relationships with providers. And so what are the challenges in delivering a personalized care experience? It starts with operational inefficiencies. So, too much of the administrative tasks are being put on the providers. They're spending way too much time in the visit, clicking, typing, and then way more time after the visit, usually at home where, it should be more of the work-life balance where it's time for family and personal time, doing the administrative tasks of running a practice. A lot of these are outdated systems, a lot of manual processes, and there's just limited interoperability. So, every time a new technology comes across, if you go to a conference and walk through the exhibit hall, yeah, these are neat. How does it fit into my workflow? Like, how am I going to make this actually work for my practice? When you talk about supplements, and we see so much interest in supplementation and lifestyle discussions, what we believe is sort of the foundation of whole person care, in direct primary care, you've built a practice and a practice vision to connect with patients and spend time with patients. And that ultimately means you want to help them in that lifelong journey. You want to talk about, how are you sleeping? How stress is impacting your life, and supplement recommendations can be part of that. It is just that, it's a supplement to your recommendations. But if you're making those recommendations, managing that is really inefficient. There's a lack of integration inside of the HRs. If you want to stock products in your clinic, now it's inventory management. You're either putting that additional administrative burden on yourself or your staff, delays in fulfillment, having to throw away bottles that have expired because you're just not using them, or patients aren't coming back into the office to purchase what you're recommending. Patient engagement is time consuming. It takes staff and takes time, and sometimes provider time, to just maintain engagement with the patient to keep that relationship going. And ultimately, Fullscript has built a lot of those tools on your behalf to be an extension of your care. And then fragmented workflows. You've got a scheduling platform, you've got a billing platform, you've got treatment planning tools, you've got patient communication. Too often that ends up being, technologies you've added one after another, and then you look up and you're like, man, this is incredibly inefficient can I just have one platform that does all of this for me? So we've got sort of that vision when you talk about Elation and Fullscript as an integration. So Fareed, you want to walk through the case study with Renew Integrative Wellness and kind of share their story?
Yeah, absolutely. Thank you, Dr. Glad. So yeah, this case study in this story is based around Renew Integrative Wellness, which is a mutual customer of Elation and Fullscript based in North Carolina. For them, the biggest challenge they had, and very similar to what Dr. Glad just went over, right? It's the inefficiencies in supply management. There's the time-consuming aspects of patient engagement, not having that streamlined workflow and having it be fragmented. There's a lot of burden on providers. So if we think about everything that's required of you from a clinical documentation standpoint, the amount of pajama time that you have to deal with dealing with administrative tasks, outside of the four walls of your office. And then, just thinking about, the aspects of being a small business owner, right? I think those sometimes are the things that goes over people's heads are you're not only clinicians, but you are also running businesses. And there's a lot on you to be able to try to kind of figure out how to make all these things work. And the more you can reduce manual processes, the much easier things can become. So what the solution for them was, when Elation and Fullscript, as I mentioned earlier, we launched our integration back at the end of 2024. What that was able to do for this practice was unlock just a smarter, more streamlined approach to their patient care. They were able to then seamlessly connect Fullscript for their supplement platform and have that work seamlessly with their Elation EHR. It reduced kind of some of that friction and the clinical workflows that they needed to kind of drive better patient outcomes and the goals that they had with their patients. And then obviously, it's built to kind of support both the provider and the patient, which is one of the really great parts of just Fullscript, right, is that it's a vehicle to help clinicians, but also just makes that process so much easier from a patient engagement standpoint, and even purchasing supplements, right, for them. So just make it easy and efficient. So what the results were and what this practice was able to get out of it, right? They were able to then, direct high quality supplement delivery to their patients. So as you can imagine, myself being a patient in a model like this, and also a Fullscript user, right? So my provider uses Fullscript, being able to very seamlessly and easily go to a storefront, be able to, find the recommendations they made for me. They make it even easier, right? I have the recommendations. I can just click, have that directly delivered to my door. So having that ease of delivery, not having to go do the research to figure it out or go to a CVS is amazing. Improve compliance and streamline care plans. So, on top of having such a high quality library of different supplements and products that Fullscript has, there's a lot of great treatment and care plans in there, just making things easier and seamless for you. So it's not just about the supplements and the inventory side of it. There's quite a bit of value, right, from the care plan side as well. Just the digital first workflow, as Dr. Glad mentioned, having to deal with things like inventory management, the risk associated with that, right? So you have to take on the risk of getting all the inventory, storing it. There's a barcode scanner that you got to go through, figure out what you're running out of, order more of it. It's a lot of hassle to put on top of everything else that you have going on. So just having those digital workflows and making it easy from that perspective is quite amazing. And then, of course, worrying about things like quality and sourcing. One of the things, whether you as a clinician, you having to go out and do the research to figure out what are the best fish oils, what are the best vitamin Ds, what should I actually be recommending, right? Because part of that personalized care journey is having that trust and earning that trust with your patient. And you don't want to recommend things that maybe aren't great, right? And so having to go and do that research, or having you as a consumer, as a patient myself, having to go figure out what's the best supplements can be very time consuming. And Fullscript takes the work out of that. They have very impressive quality standards and the things that they do to make sure the absolute best products are in there. So take care of a lot of that work for you, so you don't have to hassle and do that. The adherence and the follow-ups, so there's automated things that will constantly remind patients of when they're running out, when they need to reorder, and everything from that perspective. And then obviously the sustainable revenue side. So I talked about, not having to take on the risk of buying inventory, holding it, selling it. This is also a sustainable way to drive more revenue. As independent physicians, owning your, own practice, every little bit of revenue is helpful, right? And so Fullscript makes that really great for you, so that not only can you provide these benefits to your patients, but there are some revenue capabilities and opportunities for you to be able to drive from that perspective. And then
that's awesome.
a little bit more about the benefits, I'll pass it back over to you, Dr. Glad.
Yeah, well, you did a good job like talking about the value props of Fullscript within that. So I appreciate that. But yeah, so let's walk through sort of benefits to practice, benefits to patient, and benefits to the clinic. So ultimately, as Fareed said, I mean, you have a very large catalog of the highest of the highest quality in the industry available to you with Fullscript. So our quality team and our medical team pair together, and they vet every brand before they make it into the catalog and continue to collaborate and vet those brands throughout the entire process. We're now testing bottles off of our distribution center shelves and making sure that the purity and potency has maintained itself as it went from the brand into our warehouse. So again, quality matters. The American Medical Association Journal of Ethics paper from 2022 really highlighted the concern of the industry around supplements and patients going to get their own supplements and the safety risks and the outcomes risks. So, really preserve that within the Fullscript catalog and ensure patients are getting those trusted evidence-based products per your recommendation. You've got simplified plan creation here. So we've built 65 plus protocols today that are evidence-based, giving you the confidence based on the condition or what you're trying to prevent for your patient with the products chosen for you. Those are all customizable. So if you have, a certain ingredient you're passionate about or a certain form or brand, you can switch those protocols out and make them your own. And just reducing all that time spent documenting and planning, it's all one click recommending. And again, part of the integration, so it's baked into your workflow. From the patient experience side, so we see increased compliance and clarity. So patients understand the plan because, again, you can provide some of the resources and educational materials that are within Fullscript to attach to your plans. Patients can understand why they're taking something, why it's important, why quality matters. And now you can sort of guide that without a lot of work on your end, letting the platform do what it does. And then you've got the automated follow-ups to increase adherence. So again, this is an extension of you to ensure that your patients stay on their treatment plans. And we really encourage patients to use the mobile app because what we see is increased engagement, increased reorders, patients staying on their plans. They can upload their current supplements list. They can set reminders to maintain daily reminders of what they need to be taking. And so again, all is an extension of your treatment plan baked into the platform experience. And then practice operations. So again, efficient digital first workflow integrated into your Elation workflow. So manage everything in one place, not two screens, not two computers, not a disjointed experience, which will free up time for you and your staff to allow just that streamlined supplement management, not having to handle inventory or manage any of that. And again, no inventory, no problem. So you no longer need to have in-office stock. Now, that being said, you can order wholesale through Fullscript to populate a small in-office inventory. If you really like the experience of patients walking home with their first bottles, I think that's great. I think that does increase, the adherence of the patient on the plan. But if you then put that into Fullscript, we will handle the refills and the refill reminders to keep them on plan and not expect them to come back to the clinic for those refills. So we call that a hybrid experience, which works really well too, depending on the kind of practice you're running. All right, so covered all of the content. Would love to pull Sarah back in here and walk through any questions anybody has and dive deeper. Well, I'll kick off with the first question if Sarah makes it back in. So the first question was, can I tell patients they can use FSA funds to pay for supplements through this website? 100%. It is one of the core value props of using Fullscript. These are a provider's treatment plans of supplements for that patient, which inherently means the provider has deemed that medically necessary, which immediately qualifies it for HSA or FSA payment. And so I encourage all of my patients to use HSA or FSA to make their Fullscript purchase. Significant savings, obviously, from a tax protected perspective. So that's absolutely something that's encouraged. We do some of that highlighting to patients in the platform. And then what I'll have my patients do is just print out their treatment plan And that is what they need to sort of validate the fact that it was medically necessary for their purchase.
Hi, Dr. Glad and Fareed. So sorry about that, everybody. Right as you called me back on stage, I had a slight little glitch. So I am back and ready to join you for Q&A. The next question is there ever going to be a point that it opens up Fullscript Elation for nurses to assist the providers?
Yeah, I can take that. So I think, Renee, we're as we just launched, right, and had this integration kind of go live about 3 or 4 months ago. I think we'll constantly keep working together to kind of iterate and evolve that. So I think while I may not immediately have a quick answer for you, I do know that enhancing that experience and making it even more seamless is something that we have planned from that perspective, just because, you know, we also want to make sure that fragmentation and some of the things that Dr. Glad talked about earlier are things that we solve, right? So I think while we have a good starting experience, it can only get better kind of from here and make it more seamless for you all.
Great, thank you, Fareed. The next question is, what percentage of revenue of the Fullscript products come back to my practice?
Yeah, so a couple important notes about sort of the business model. Fullscript is a completely free platform for you as the provider to use. There will be no fees to the provider to use this service. The business model then is there is a 35% share of the supplement price that the practice can participate in. And that means you can take the full 35% as support for your practice, or you can split that up between patient discount and what supports the practice. And that you can kind of write that discount per treatment plan. You can set up the patient account and provide them a discount. I'll tell you, across the 100,000 practitioners using Fullscript today, that discount is on average 10 to 15%. But really, it just kind of depends on what you decide as a business model. And then the other aspect is Fullscript will run promotions for you a couple times a year. So these are store-wide, platform-wide sales that you can opt into. You do not have to participate, but we find this in our practice an incredible way to engage patients, bring patients back onto Fullscript for their treatment plans, you know, give them anywhere from 20 to 25% off of all of their purchases. There's one coming up here in the spring. There'll be one in the fall. So we handle all of that. I can tell you, as a practice that used to do that ourselves with our in-clinic inventory, my staff celebrated when we used Fullscript for our promotion. You know, we had so much out of stock that we had to kind of let patients know it's going to be a couple weeks. Staff were there till 10 or 11 at night, putting things in boxes. Fullscript has taken all of that workload off of us.
Great. And on a similar topic, in the hybrid model, do I make a similar margin regardless of where a patient orders?
Yeah, so if you purchase wholesale, you purchase at 50% off of MSRP. So there is a difference whether you're going to manage that inventory in the clinic or whether you're going to use the virtual dispensing platform. Again, we've got the studies over time that shows a hybrid experience is probably the best path if you can manage the in-clinic inventory, because the lifetime value of the patient returning to your clinic is significantly less than having a bottle that they walk out with and then letting Fullscript handle the auto refill capabilities, the reminder system, and allow you to kind of keep that patient on that treatment plan without having to have in-clinic inventory.
Great. Thank you, Dr. Glad. The next question is, are patient total charges competitive with the Great Wall of Supplements at box stores or Amazon, etc.?
Yeah, that's an awesome question. I'm happy to handle that one as well. So like quality matters here. So, you know, when you talk to your patients about the importance of being on the right form and the right dosage and proven products with purity and potency, likely that is going to cost more than walking into a drugstore and buying something off the shelf. Now, some of these, if you know, as you talk to your patients about quality, some of these quality products that are in the Fullscript catalog can be found on Amazon. And usually then the opportunity is to use your patient discount to make it less expensive than what they can get on Amazon. So one of the commitments to brands that moved from healthcare professional only to also provide direct to patients on Amazon, they still maintained, you know, a sort of consistent support of the practitioner network by saying we're only going to sell at MSRP or MSRP plus. That gives you the ability then to use your discount and say, listen, you can try to find this on Amazon, but you have to buy it from the brand store. Or if you look at the headlines, who knows what you're buying? There's too many counterfeit stories. There's too many doctored product stories and dangerous products out there. But if you use Fullscript, I'll give you a 15% discount, and it will be significantly less. In addition to this being a treatment plan and easily able to use HSA and FSA funds, that's where you really change the game. And then again, bringing back the quality piece, all of Fullscript's distribution centers are NSF certified and CGMP certified. And other retailers cannot make that claim. So again, quality, but then use your discounting to really drive home the fact that they can get it less expensive here. Any purchase over $50 ships to them for free. So again, competitive from the pricing perspective as well.
Great, thank you, Dr. Glad. The next question is this integration included in my current Elation plan, or are there additional fees?
Yeah, great question. So it is included. There are no additional fees. And then as Dr. Glad mentioned earlier, Fullscript is a free platform. So there's no fees specific to creating a Fullscript account or utilizing it or anything like that.
Awesome, thank you. The next question is, can I build and save custom treatment plans in Fullscript that are easy to apply within Elation?
100%, and we would encourage that. I would, if you have already some supplement protocols you're recommending today, you can absolutely build those very easily. Choose the products, choose the dosing, choose the messaging that you want to send to the patient, and easily have that queued up for one-click recommending. If you're just getting started and you don't know what to start with in terms of a protocol, I would encourage you to look through the templates in Fullscript, make some of them your own, or use what we've already built, because again, heavily evidence-based with the evidence supporting it right there. There's also the feature called multi-patient plans, where you can now take your protocols and promote those to your entire patient population. So that works really well, say for the promo. So this upcoming promo, my clinic built a spring wellness template around seasonal allergies and a sports performance supplement protocol, because again, people are going to be outside, they're going to be exercising, they're going to be sweating. And so I put 3 products that I feel strongly about with the dosing in those templates, and I'm using that as part of the spring promotion for patients to consider if that's appropriate for them.
Great. I'm going to have to take a look at these templates, Dr. Glad. Both sound very timely. The next question is, how do I have this added to my Elation account?
Yeah, so I am also replying in the chat here. But if you do not have an account, or if you do have an account and want to turn it on, and I'll include this in the general chat too, you can visit the Elation Partner Hub, and specifically it's partners.elationhealth.com /partners/Fullscript. That will link you to where you can sign up for a Fullscript account, or if you have one, there's an authorization and consent form that you can fill out, and that will initiate the integration process to start, and Elation and Fullscript will work to get your account integrated.
Perfect. Thank you, Fareed. And thank you for adding that in the chat for everybody.
Of course.
The next question is, do you send the supplements directly to the patients? Is postage included in that?
Yeah, so we do all of that work for you. And again, like the distribution centers are, of the highest quality. We have all the refrigeration required to maintain supplements in their optimal form. Those supplements are then packaged on ice when it's appropriate, and we handle all of that for you. So once you send your treatment plan, your work is done, right? This is part of the workflow efficiency. Fullscript will then reach out, on your behalf from your dispensary in your name with your treatment plan, and we'll handle that transaction. Patients, again, if it's over $50, the postage is completely free. It gets right to their door in 1 to 2 days. Again, we have 5 across the country so that we can get there, within a couple days to each patient. And we will handle all that. And again, the refill reminders are all there as well. Patients will get an additional 5% discount if they subscribe to auto refill. So I always encourage practitioners. I'm back. I always encourage practitioners to use the duration field as they're filling out treatment plans, so patients have an expectation of, am I going to be on this for 3 months? Am I going to be on this ongoing? And that would encourage them to sign up for auto refill when it's appropriate. But we handle all of that work for you.
Great. So it looks like the last of our questions are actually about how to get started. Is there any videos or links to watch how to take the practical steps to get started, which I think segues perfectly into our demo. So Arthi is going to go ahead and kick us off with that.
Hi, everyone. Thank you very much, Dr. Glad, Fareed, and Sarah. That was an amazing presentation and great questions, everyone. So over here, I am going to walk everyone through a demo about the Elation Fullscript integration and how we can get started, connected, and send treatment plans through Elation directly from Fullscript. So here we're going to start off with going into our Fullscript account. If you don't have a Fullscript account, you can actually head over to the link Fareed posted in the chat to sign up for your free Fullscript account and get started. When we're in our Fullscript account, we're going to click our name here in the bottom left corner. We're going to go into integrations, and we'll start seeing all the partners Fullscript partners with, and we'll actually enter into Elation. From here, we're going to click Get Started Now. This prompts us a box that enters a authorization and consent form. So this essentially is asking the practitioner to agree to connecting their Fullscript and their Elation accounts to ensure that we can streamline and connect the data. So you want to be able to see your patient's treatment plans within Elation as well as within Fullscript. So here you can see that my name and email are auto-populated, and we're just going to ask you to confirm your Elation practice name. If you are unaware of what your Elation practice name is, we have a little reference guide article hyperlinked here for you to figure out how to navigate to your Elation practice name. So for testing purposes, I will say test name here. You're also able to enter the number of providers in your clinic or practice, as well as the number of patients you see on average. This will also support Fullscript as you have an account manager to support you in the best way possible based on the size of your clinic and practice. So I will just leave these blank for now. And then we can click a few of the terms and conditions, again, just authorizing that you're okay with connecting both of your accounts. So once we send this through, I actually have to put in a number. We send this through, we can see here that our process or request is getting reviewed, and within a couple of business days, you should be receiving an email. So Fullscript and Elation will work on the back end, nothing needed from your part as a provider, and we will enable your integration. What this looks like on your end is you will see an email that looks something like this, telling you that there's one final step to go through in Elation to get your Fullscript and Elation integration connected. So here you'll need to sign a business associate agreement, which I'll be showing you momentarily, and you can get started with creating your treatment plans. When we hop into Elation now, let's say you received that email, we will go through, and I just want to preface here, this is our demo sandbox environment, so yours probably looks way more elaborate than mine does right now, but we will find a test patient in here, which will prompt us to open up the patient's chart in a new tab. Once you've received that email, you should now be able to see the Fullscript button within your patient's chart. Mine here as a test demo says a year, you will just see Fullscript. Once we click this, it'll direct us to the Fullscript page. For the very first time, it will actually ask you as the provider to sign in to your Fullscript account. So you will be prompted there. And then as the Fullscript account owner, you will be asked to sign the business associate agreement. I do want to caveat here, if your practice isn't eligible to sign a business associate agreement, please reach out to us at elationintegration@fullscript.com, and we will support you in bypassing this step if necessary. So I will go down here and sign away and submit. Once this is done, this will automatically direct me to being able to send my treatment plans. So here we can see the patient's profile. Both our patient's profile from Elation and Fullscript have been connected. So now you don't need to worry about creating your patient in Fullscript and then having to go back into Elation. We automatically connect it with this integration. Here you can begin building out your treatment plans by clicking Build Plan. And we can either go through searching for different products that we'd like to add into our supplement plans, or on the left-hand side here, as Dr. Glad had mentioned, you can leverage the resources and templates you have created or what Fullscript has created for you too by our medical team. So for testing's sake, let's say we add this vitamin D here. Maybe I'll search for a magnesium. And we can, of course, use Fullscript's very comprehensive filters here to really get specific on what we'd like to add. And we can add another product in. Once we're happy with it and we're okay with what we see in our patient's treatment plan, we can go in here and we can review it for sending. If you'd like, you can add a message in here. I'm sure you're probably also adding notes into your Elation chart, so completely preference. You're able to adjust your dosage instructions, and of course, this is just manufacturer's default that you'll see initially. And once we're happy with it, we can go ahead and send the plan. Once this is done, we'll see a little green box here telling us that the plan has been sent, and we can actually now see this within the Elation platform. So if I hop back in and refresh my page real quick, we can now see here, dated today, that I have the 2 supplements that I recommended to my patients with the instructions as well as any notes I may have added. On top of it, recording in chronological record, providers are also able to see their patient's supplement recommendations within their permanent OTC mid section. So if I'm scrolling down here, I can see again that March 2025, I recommended some Metagenics vitamin D3. And your patients, similarly to how they have always been receiving their Fullscript recommendations, will continue to receive an invitation via Fullscript in their email, letting them know that their provider has sent them a recommendation. And that is all.
Great. Thank you so much, Aarti. And thank you everybody for joining us today. As a reminder, we will be sharing the recording in a few days with everybody who registered. So keep an eye on your inbox. And if you missed the email or want to find it later, it will be available on fullscript.com if you visit our webinars page. Thank you everybody and have a good rest of your week.